non-invasive pain treatment can provide significant relief for approximately 80%–90% of patients with chronic pain, according to a review paper co-authored by Johns Hopkins pain experts. This therapy, approved by the FDA in 2009, delivers electrical stimulation through the skin via electrodes placed above and below the area experiencing chronic pain. It aims to replace pain signals from damaged nerves with signals from pain-free areas, disrupting the pain signals sent to the brain. Scrambler therapy may be more effective than transcutaneous electrical nerve stimulation, TENS, another non-invasive therapy. While TENS therapy offers relief only during electrical stimulation, Scrambler therapy can provide lasting results, reduce opioid use, and potentially reset the brain's perception of chronic pain.
If you enjoyed this video, please give it a thumbs up and subscribe to my channel for more great content.